Hello, everyone, and welcome back to today's conversation. Today, we'll be talking about the future of data-driven health technology. I'm very pleased to have a special guest with us. We'll be exploring patient engagement, what's shaping personalized health, and how companies like InsideTracker are leading the way with science-backed actionable insights for health and optimization. Joining us today is David Lester, who's the founder and strategic advisor of InsideTracker, and whose unique journey spans pharma, FDA, and health tech innovation. So, David, can you share with us, first of all, a little bit about yourself and your journey from Pfizer and the FDA to founding such an innovative company like InsideTracker?
Yeah, thanks very much. So I did spend several years at the FDA and worked in the Center for Drug Development and Research. So I got experience in understanding the regulatory climate in healthcare. I then was recruited and worked, first of all, in Pharmacia, where I was setting up an innovation group that was focusing on innovation in clinical trials and trying to bring new technologies into clinical trials. Pharmacia was acquired shortly afterward. I joined by Pfizer. I like to think that Pfizer acquired Pharmacia because of me, but that's not quite the truth. Pfizer, it was very fortunate for me because Pharmacia the headquarters were based in New Jersey, where majority of the drug company headquarters are. But Pfizer's headquarters were based in New York. And what happened was the group that I joined in Pfizer was based in R&D, which the headquarters was in Connecticut. But I didn't want to move because my children were in school. So my boss said to me, go to New York and find something to do. So New York was the commercial headquarters. There were about 3,000 people, of which there were only at that time about 10 people from R&D that were there. So I was one of an exclusive bunch. And it was a very, very interesting challenge. And this really gives you a sense of the transition for me from doing development of products into selling products. And that's a huge shift. So the commercial is all about selling. So it's a very different mindset. It's a very different challenge. The people are very different. And in a way, it was liberating for me because what I began to understand was the business of healthcare. And in understanding the business of healthcare, I really began to understand how broken it is. And it's really broken. And it's been broken for a long time. This is going back 20 years. And it was even longer than that. But when you talk to companies that work in healthcare, they'll never admit that the system is broken. The reason is they're making money from it, right? So it just doesn't fit. And it doesn't fit their mantra. But I did get to understand the business of healthcare and what the driver was. The other thing I realized very strongly was between the FDA and pharma is innovation in healthcare is incremental. They're only small changes. It's a new drug, it's new. But when I was trying to bring new technologies to enhance, where I'd say, let's add a diagnostic test to a drug and it'll make it more effective, it was very, very difficult because this was not the core business of the pharmaceutical company. Their core business is to get a drug, take it through the FDA, and bring it on the market. So I left. What happens with all innovation groups in pharma is they usually shut down. When things go hard, they get a little difficult, they close them down. It's the first thing to go, and actually most corporations, is innovation. And I decided then I had an executive coach, and she explained to me that my mentality was not suited for corporate environments, because I constantly challenged the system. I did what I thought was right, not what they wanted me to do. And this was a very big shift for me. And so I realized that I need to try startups. And this is that journey began, the startup journey began. So I worked for an initial startup that was working in diagnostics. But I saw this challenge in that healthcare is very slow in adopting new changes and incremental changes and innovation. And I met my other co-founder, Gil Blanda, when I was consulting for a company that he was working on that was looking at bringing in the systems biology, which was analyzing the different components that actually contribute to particular pathways. So it was a small startup. I was consulting with him, and I asked him the question. I said, could you map out the pathway for normal, healthy living? if you look at healthcare, healthcare is always dealing with disease. And a classic example is Alzheimer's, which has spent tens of billions of dollars trying to develop products and services, and it's got nothing. We don't understand healthy aging, the normal brain, the aging of the brain. What we do is we analyze the decaying brain and disease brain, not just decaying, not the normal aging brain, but the disease brain. And that's what I was asking my co-founder Gil. I said, could we map out what the pathway would be for normal? And he said, yes, we could. And this was the beginning of InsideTracker. So we started talking about it, and we said, all right, what do we want to do? So what we realized is we want to find indicators, and we picked initially blood, easy blood markers are easy to measure. Genomics at that time wasn't as developed, and it was very expensive. So we wanted markers that would be relatively cheap and easy to get tested, just simple blood draw. They were being done all the time. But the key thing was they correlated with two characteristics. One, they were easy. Three. One, they were easy to measure. Two, if you change your diet, those markers would change their levels. And three, we decided to start off with athletes, because athletes are very motivated and driven. And if you tell them to do something, they'll do it. So if you're looking at it, this was not about disease. This was all about health and maintaining your health and getting healthier. And this was started in about 2007, 2008, and it was really the first company to actually realize this as a commercial product. So it was a groundbreaking company, and it's still going quite strong. It's evolving quite well. Now, I left InsideTracker relatively early because I decided I wanted to go and work in Silicon Valley for a while because, again, I've always been fascinated by innovation. And I joined a company that most people have heard of called Theranos. There's a wonderful book about Theranos. The founder's in jail for 11 years. But the concept behind it was very, very intriguing. Again, it was about getting blood markers and getting them in a timely manner that you could better manage your health and your disease. And there was a hardware box and there was data analytics, but also very strong data analytics. This was in 2009, 2010. This is only 15 years ago, but it was in those early years of talking about data. But it was saying not only collecting data, but doing something with the data. I left after a year because the CEO, again, read the book about the founder of Theranos, and you'll understand why I left. And then I came back to Australia, and I've worked for a number of things. But I now work with a number of startups. I'm a co-founder of about 3 of them. I'm not as active as I used to be. I tend to be more focusing on commercial strategy. But when you talk about data, the data is the key behind all of them. But what's more important is the question. What is the question you're trying to answer? And there's this whole boom in AI, which we were using primitive AI back in the 90s. This is not new. We just didn't have the computing power, so we didn't have the data. But the issue is still, what is the question you are trying to answer? And I talk with many AI companies, I advise some, and I can't seem to get across to most of these founders, it's not about the technology. Health and healthcare are about the questions you are trying to answer. And some questions we don't have enough data. And when I talked again about Alzheimer's, we have very little data on the naturally aging brain. So it's very challenging to ask questions about natural aging in the brain because we don't have the data. So you need to start off by saying we need to collect a lot more data. And fortunately, the National Institute of Aging is beginning to do this, even though with Trump there, I don't know what's going to happen to him. But they're beginning to realize this. So healthcare tends to get hooked on new technologies. But then when they get hooked on them, they don't know what to do with them. And I should say that my group in Pfizer was the first group to use a wearable in a clinical study. And this was about 2003. We got the data, we presented it to the team didn't know what to do with it. So it's again the same problem. It's very easy to get data. The issue is, what do you want to do with it? So that's where I am now. I'm really focused on this big picture of health and wellness and healthcare. I don't really care where it's going to come from, but you have to show some good examples of, I've got data, it's good data, and this really has helped me in terms of providing better outcomes, because everything should be about outcomes. Whether it's just remaining healthier, whether it's about preventing disease, whether it's about treating disease, it doesn't matter. It's the same issue you're dealing with. Does that sort of give you my history of how I ended up to where I am today?
For sure, for sure. I guess I'd ask you, the companies that you're working in now in Australia, what kind of role are you playing in these? I know you said you're looking at the commercial strategy and things like this, but what does like a typical day look like for you in terms of running these companies? And also, do you still have much of a role strategic advising for your previous things?
Yeah, so I do a bit of all of the above. So I, what I tend to do is look for people that have interesting technologies. Number one. Number two, these people have to be what I call normal. In other words, I can actually deal with them, and they respond. The issue is, I've got a lot of experience, and that's what I bring, and it's in a lot of different areas. So if you're going to come and tell me how things should be, I'll generally tell you you're wrong. So these are companies that have an interesting problem, or they've got a technology that can answer a potentially interesting problem. And then I come in and I sort of help them develop the strategy for their companies, some of which I'm a co-founder. I've got one called Sage Women's Health, which is focused on women and menopause, something I believe very, very strongly. I think we have a great opportunity in women's health in general. So I've got that. There's another one I'm using, is X-ray company, where we have basically it's the future of X-ray. And there's a company in Australia that's doing very, very well using AI for X-ray analysis. And I know one of the senior people, and I've said, when our technology comes out, you become obsolete, because the data we've got is better than any data that you use to generate your AI. So it's, again, we're talking about one of these business challenges. How do you protect your business for new changes, for new innovations? That's another thing that I like to focus on as well. Then I do advise some other companies. I still often interact with my co-founder, Gil Blander. I'm not active in InsideTracker per se, but I still chat and discuss and talk about some of the options. So the average day, I'll generally have 2 to 3 different programs that I'm working on. I'll spend an hour or two on each. And I think that's what keeps me young, is you're shifting your mind from one to the other. But the other thing you gain from doing that is you've got experience from one area that you find then is applicable to another area. So you start gaining advantages that someone who's stuck in one space and that's all they're doing will never ever see. So I don't want to be a CEO. I've done that. I'm more involved in using my knowledge and experience to help others, to bring them to success. That answer your question?
For sure, for sure. So yeah, I wanted to touch on, you mentioned the challenges around data, and something that we're really interested in is patient engagement, which obviously is a big part of some of the things you've been involved in. It's now an $86 billion market, but something that really seems a challenge is the adherence to it. It remains really low in preventive health, and with all this investment going on and growth in the market, as you said, InsideTracker was really ahead of the curve, but now you see other companies coming through, wearable technology really making moves. How do you think that that gap gets bridged, so to say, in terms of actually using all of this powerful technology and using this data and finding a way to get people to commit to it, to really looking at proactive health instead of reactive health?
Yeah, I mean, the concept of patient-centric, it goes way back when I was in pharma over 20 years ago. And you're right, it hasn't really progressed. I remember going to, I think it was the first digital health conference. It was in San Diego in 2006. And the first session, they had the head of Google Health, the head of Microsoft Health, and the senior person from Medscape. And everyone was saying back then the key thing is search, so that people can search and get data. And I knew the moderator, and so she let me ask the first question. I asked, what does a person do with that information when they get it? Right? And so they said, well, they make a decision. And I said, well, how do they make a decision? How do they know what's good and what's bad? So they said if it's like from a reputable place such as Johns Hopkins or the Cleveland Clinic, that's what they'll go on. I said, but the problem is Johns Hopkins and the Cleveland Clinics can't agree. So this is where you're seeing AI potentially acting as maybe it's better because it can take all of that data and provide you a summary. But I think the key thing is, and it talks to really what you're saying, is it comes back to the questions you're trying to ask where you demonstrate how this can work. And I personally believe women's health is a remarkable opportunity. You do hear a lot of it's the hot area. The issue is I don't see yet what are the questions, the right questions that are being asked where you can use this data, whether it's a wearable, whether it's AI, whatever. The questions aren't there because we don't know much about women's health. If you look at healthcare, which is mostly disease care, it's focused for decades on men. It's men in clinical trials, it's men. So there's a big gap, but I do think that this is where you have a real opportunity. So if you can find a space there, and this is like with Sage Women's Health, we're talking about menopause, but just aspects. So for instance, we're looking at hot flushes in menopause, and we're doing some work, and we found that there are 3 different pathways that a woman will have a hot flash. So if you're treating a hot flash, you have to know which of those are the pathways, which pathways are you going to be doing in order to get an outcome. That's not how it is now. So this is where you're beginning to say, we can start asking better questions. We can design better management of the data. And this then allows us to use different challenges, which will ultimately lead to better outcomes. And that will then demonstrate how all of these pieces in what I call that jigsaw puzzle begin to fit together, because it is a jigsaw puzzle. It is. And what you find is companies have the technology and they're saying we're in women's health. But again, they don't know a question. They don't know if what they're measuring is relevant, all this. So it comes back again. You need the data, absolutely. But you need a way of managing that data so you can understand the pathways where you actually can have an impact. Does this sort of give you an answer? It's an example. I mean, I said women's health because I'm working in it, but I think it's a very, very big opportunity. And anyone that looks at investment in women's health, it's enormous now, absolutely enormous. So I think that's, and the good thing about women's health, we can learn from all the mistakes we've made in the past. And so we're not going to do that again. So this time we're going to do it right. So I think this is a very, very exciting time. We've now got the tools, as you mentioned, wearables, AI, all this. We now begin to start seeing some really great questions where we can start to integrate all of these components and look for novel and really important ways of improving outcomes. And it can be in disease, it can be in health and wellness. It doesn't matter. The good thing about women's health, it's the whole range. It's everything, right? It covers both of those arenas. So it's just a matter of picking an area where you can actually you can focus and you have the opportunity of creating and getting answers.
So I guess you're seeing more the growth and I guess adoption of this kind of technologies coming from a more medical standpoint now rather than a consumer facing standpoint with things like Whoop.
No, I wouldn't say that. I think it can come from certainly the reason why women's health is so interesting. It's almost like with InsideTracker when they picked athletes. Women are very motivated, way more motivated than men are. Things like menopause, where they go through, and perimenopause, where they're going through 15 years of their life, where their daily life is being challenged at the family level, at the work level, all this. That's not disease. So I wouldn't call menopause, perimenopause a disease. That's part of the natural cycle of women. But the consequences, you could say, Well, they're like classical. It's almost in a way, if you look at diabetes with all of the different components, it's the same thing you could say with in terms of things like menopause. But these are not disease related. These are things that a woman is experiencing in everyday life. So sleep, stress, all these things. How do they better manage that to help them manage that cycle of first of all prepare them when they go into menopause, and then when they are in menopause, actually managing themselves better. And the other reason why I tend to go to a space like this is having been at the FDA for many years and coming from pharma, I don't think coming through a regulated industry is the right way to do it, the traditional regulated healthcare, because the demands in terms of clinical trials are just, that's why you never see supplements getting FDA approval. It's too expensive. And I can tell you, that's a separate hour and a half, 2 hours. I can tell you about the limitations of clinical trials. I don't think you need them. What you need is well-designed studies. And what you do is you get an answer, and then you implement it, and then you get more data, and it will improve. It's a version 1, a version 2, a version 3, version 4. That's what you can do if you avoid healthcare. You can't do that in healthcare.
Hmm. Interesting. And
Very different
other
model.
than other than women's health and sort of the developments that are happening there, what's, if any, of other major shifts are you seeing in the personalized health space right now, and like what's really exciting you that you're witnessing?
Well, it's fun. If you go back to InsideTracker, they now have a lot of competition, but they're all doing the same thing that InsideTracker was doing 15 years ago. So it's not coming from there. But I think there's some, I think I see some different business models popping up where you're seeing startups or companies, more than one, working together to come up with a better solution. That's very exciting because I learned that way back when we were running clinical trials. A single technology won't have a significant change. But if you could bring two or three to affect 2 or 3 weak points in that clinical trial delivery process, you will have a big effect. And I think that's what's exciting now is I'm seeing some companies that have different technologies saying, you know what, if we work together, we can answer much bigger questions. And I mean, I tell all these technology I work with, I say the model is Intel in the engine. Intel is one component of a computer. It's just one. It's a critical one now. They made themselves critical. They're making a lot of money off that one little component, but they had to understand all the other components and integrate it. And I think that's where those sort of companies, and that's the things that I watch out for when you start seeing these cooperative type programs. People are looking at bigger questions, more meaningful questions. It's not necessarily women's health. It can be anywhere that this can be done. But that's not the nature of a startup. A startup is, you do your thing, you focus on it, laser focused. Elizabeth Holmes used to always tell me you have to be laser focused, but she was never laser focused. But I think it's not going to work in healthcare. It doesn't. And this is why I think it's so hard for startups working in healthcare. It's very hard. I mean, if you work in a device, medical device, it's something different. But all these other ones in data, very difficult. Because you're just one small component of that overall solution that you're trying to provide. I found that founders, particularly like engineers, people, they can't accept that. It's very hard for them to understand that.
There was a article this week actually in the UK. All babies in England to get DNA tests to assess the risk of diseases within 10 years. Kind of touches on the same kind of subjects we're talking about. What role do you see governments playing in this adoption of these kind of technologies? Or do you think it's going to be very much the private sector which pushes this forward?
I think that's a great question because when you're talking about what the UK is doing in terms of testing for genomics and genetics, that really is a public health issue. That's what they potentially are looking at. Yes, they're looking at diseases, etc. But the government, I think, where they're effective, and it's the same in Australia. Australia, particularly, you see, it's very strong. You see it in the US. I think in the UK, I've worked there a lot. The government can be very strong in public health. It can have a strong influence and a good influence, and they manage public health. Things like smoking laws, and even like in Australia, they had sunscreen, they had seatbelts. These were very, very successful programs that the government implemented. There were corporations providing and developing the solutions, but the government oversaw them. And I think that's when you see the value of the government. So I applaud the UK for what they're doing. Now they've got to find the partners, which I was talking to just before, that they can begin to start addressing some of the key questions that they wanted to answer. I mean, the UK, as in most healthcare systems, the biggest problem they got is money. It's too expensive. So if you can get into preventive, which there's not much, that's the unfortunate thing. Most governments don't put much into preventive. You will reduce healthcare costs. But I think it's about bringing the government. So the government is almost like they're the stimulator. They're the ones that can basically say, this is the problem we need addressed. And then you bring in a way, this is when regulation works in healthcare, they don't tell you how you actually develop it. They shouldn't. They'll say, here are the boundaries. Now you go ahead and develop the solution. It's not how it works in healthcare again, but that's really when it's effective. So I think that's what you can do in public health. That's what you can do, what the government can very much do, and say, these are the big problems we want addressed. We've got this data. We'll help you get more data. Now we're going to work and bring some teams, make presentations, and we'll then work with that one which can actually give us the solution we're looking for. So that's when you see the role of the government, I think, being very important. But if you're saying the government should find a cure for Alzheimer's, that doesn't work. Won't work. So there's a very strong difference. Very strong.
Yeah, no, that makes a lot of sense. I completely agree. So let's talk a little bit about the future as well. So I guess for you personally in your companies, like where are you looking to take things in the next year or two? In terms of, I know you said you're focusing on the women's health thing. What's your sort of goals and roadblocks as well upcoming?
So in the women's health one, the core capability of the women's health one is they have a number of very, very good women's coaches that can coach women to deal with their various problems that they're dealing with. But what we're doing in the background is we as I mentioned about menopause, we're setting up a program where we're beginning to collect data, and we're working with a company, IPQ Analytics in the US, which are the best at analyzing data of anyone I can found, so that we can start gathering data. Now, that will then allow us, the coaches, to basically provide the best information. So we're getting the data. IPQ Analytics is doing the analytics for it, which is a system type analysis. And then we can launch internally within Sage Women's Health, be the first in Australia, where we've got this data-driven, and the data is collected directly from the patients as questionnaires we're using. We're not doing blood tests. We're not doing that. It's basically asking the right questions. So that's a program that we are going to be launching. The first questionnaire will be coming out in about a month, or even less. It may have come out now. And we expect to get data. We need about 10, 20,000 women to answer that. And from there, we'll begin to start making, be able to come up with not recommendations, but it's again like InsideTracker. The one thing that was very important with InsideTracker that I didn't mention is that I talked about food changing blood levels. If you look at it, we suggest 3 different foods to change that blood level. Now, why that's important is it's been generally shown, first of all, if an individual chooses the intervention they want, it's more likely they'll stick to it. And secondly, you generally want to give the individual 2 to 3 choices. Beyond 3, it gets a bit complex. So that's a mentality that's sort of been known. It's a mantra that is known in this space. And we expect to do that same thing with Sage and the launch of our platform to women as well. So coaches don't recommend. What they do is give you a choice. and then you choose. And then they can work with you and see how you're doing. So it's the same sort of model as what you're seeing with InsideTracker. So that one, we're hoping in 2 to 3 years' time that we'll do a national launch, or, well, I should say, initially statewide launches in Australia. Our colleague in the US is doing it already in a couple of states. He's preparing to do it there. So we're just mirroring that thing to do it in Australia. And so that for Sage is where we're looking to. So it's very data driven, but it gives you a sense of where we want to go and where we expect to go in the next 2 to 3 years. And no one in Australia is using this sort of data driven approach in the way that we are. No one. We know that. It's a very much, it's, here's websites, go and look at it, have a nice day. So whereas we're building models, biological models that actually will be much better indicators of what's relevant for you.
Wow, that's really, really interesting stuff. And as you said, like I feel like it's an area where there's so much room for growth, and probably it's actually a bit behind in terms of the research that's gone into it and what can be done. So yeah, that's really exciting stuff. Yeah, I think we'll wrap it up there. So yeah, I guess maybe let the viewers know where they can find you if they wanted to find out more about you and your companies.
Yeah, if you look me up on LinkedIn, you'll find the contact info. And again, if you looked at my LinkedIn profile, which was hacked about a month ago, and I'm still trying to get it back up to normal, but it's got a list of the companies that I'm involved in. But it does have contact information there and email. And you can certainly be happy to talk to people. One thing I really enjoy doing is talking to startups and, as I said, sharing that experience that I've had that's over this last 30 plus years to see if I can help people and help companies and help them avoid making mistakes that I've made in the past.
Sure. Well, thank you so much. I mean, yeah, it's been really insightful around everything from, from the private sector, AI, and the things you're doing now. Yeah, I think the viewers will have a lot to gain from that, and you'll definitely make sure to include those, the links, your LinkedIn, and everything like that.
That'd be
All right.
great.
Well,
Appreciate it.
thank you, David. I'll just stop
Thanks
the
very much,
recording.
Oliver.